Welcome to the continuing series of South Florida Hospital News leadership videos. And today we bring you Ben Rodriguez from Jackson South. Ben, welcome to the CEO series.
Thank you so much.
Ben, tell us your position over at Jackson South.
I'm the VP and CEO for Jackson South.
Could you tell us a little bit about the hospital?
We are licensed for 260 beds. We have a rider trauma center. We are specialized in trauma, general surgery, just a general community hospital plus trauma.
So Ben, tell us a little bit about your educational background, how you got to where you are today through education.
I went to school and I became a respiratory therapist. I started working and did quite well. Then from there, I went back to school. I became a registered nurse. As a critical nurse, I got interested in administration, went back to school, got in my MBA, and I became the chief nursing officer for the hospital that I was working. From there, I got promoted to chief operating officer. And lastly, I got promoted to CEO. And here I am.
During those years of challenge, including the last couple, which have been a major challenge for I think everybody in healthcare, and hopefully we'll just come out of this pretty soon. But what were some of the major challenges for yourself, your career, coming through healthcare as you did?
Well, I have to say that the biggest challenge that I have encountered in the past few years is COVID. The fact that nobody knew what to expect. It was something new, something that we had to get used to, from nursing to techs to everybody, and that we did quite well. I believe that was my biggest challenge. I'm going to tell you that something that we did, we set up a clinic within the hospital. And you know that, once again, this hospital is not very large, but we served for the community to immunize the community. Over 36,000 people came through the doors and we immunized them. And I think that's how we got to know what were the needs and their concerns, et cetera, et cetera. So that was quite good for us.
What is your, I know that there's no such thing as a typical day, but I like the term typical day. What is as a CEO, and you relating to here at Jackson or other positions that you've had as CEO, what does a typical CEO day look like? Assuming that everything is kind of, the emergency part of it is not necessarily there, but kind of a typical day as a CEO.
Well, I normally in the hospital by 7:15. That's normally the time that I arrived. I get report from my CNO, and I start walking around, just trying to assess what is going on. If what I was told requires help, I go and I'll help out. With my clinical background, I think it's an asset for me, because I can discuss it at certain levels with nursing and techs and otherwise. So I like to make rounds. I like to see it for myself, how the floors are doing, how the ER is doing, how many halls do we have. The intensive care unit, that is my specialty, I love to be there. Every time that I get overwhelmed about anything, I end up on the intensive care unit. It gives me comfort. So that's where I go.
During your journey, coming down to before South Florida and coming into South Florida, I'm sure that, as with myself over the years, there are mentors that have helped you or guide you or given you that wisdom that you carry today and kind of pass on to others. What juncture did you see that during your career path?
My first mentor in this field and administration was actually Don Steigman. Don Steigman showed up in my hospital because the company that he worked for was purchasing my hospital, and he wanted the one of the supervisors, in this case me, to give him a round. And during the round, we got to know each other, and we have become, I think, kind of friends ever since. Uh, that was my first mentor. My second mentor was one of my bosses, Ralph Aleman. Ralph Aleman took the time to teach me what I had to know in order to be a CEO. And I'm very grateful for to both of them. I'm telling you that in my case, I have always learned from the people that I work with. And like presently, I report to Dr. David Sembrana, and I have learned a great deal from this man. So that's just my little venture.
So tell me, and let's take the reverse role today. There are a lot of people coming up, early careers, mid-level careers, that you see that pass through your hospital. Some stay, some pass through. How do you, I'm sure they look at you or advice you give them, and your mentoring style for those?
I always like to have somebody that knows me and knows my style and knows what I know. So just in case if I'm not available, they can make the decision for me. So my COO and CNO are both perfect for the roles that they're in. And hopefully when I get to retired, one of them can take this position. I believe that they will be ready.
During the past couple of years, there have been very, I guess I use the term challenges, situations that influence healthcare philosophy. And I've seen it with other interviews how it's changed some people's mindsets on how they do things, how they rely on people. Tell me a little bit about what it's done for you from an educational standpoint, from a philosophy standpoint, and maybe changing some of the things you've done in the past.
Well, I believe that the pandemic really made me humble because I learned how to create a lot out of nothing. When you look at a space, in this case, a space was the biggest problem that we had. And the amount of patients that came and that they were COVID positive was incredible for us. And in order to create an ICU, we had to take over the the recovery room, and really we went through joint commission with them, with patients of the kind and the appropriate ICUs, and putting those patients, the ones that were not positive, on the recovery room. And joint commission actually complemented us on our way of thinking, because if there is a space, you can do something with it for sure. That I learned, that you have to put the patient first and everything else comes after.
What one piece of advice or thinking would you tell in early careers today that would make their journey more meaningful in healthcare?
I think that you have to learn to listen to what make an assessment of the community that you serve and provide that, and you will never go wrong because the patient always comes first.
Mhm. What, especially in the last couple of years, have kept you that mind constantly going and maybe kind of kept you up at night uh, during these past couple of years?
I believe that in my case and in everybody's case, and every administrative team in the country right now is the same. Just to wish that we had enough nursing that day, that shift, that they know what they're doing and they can provide the safe care that I think that we provide, that there would be no problems that night. So it is for a safe nurse. That is what keeps me up at night.
Ben, I know you got a busy day down there at South. And again, I want to thank you for your time today out of your busy day. And I know that you'll, as we continue through this pandemic situation, that hopefully things will get better and a little bit better for the hospital and operating a little bit easier, because I know it's a tough chore out there today. Well, again, I want to thank you for your support, and we'll look forward to coming down and visit you when we can.
Thank you so much, Mr. Felix. A pleasure.
Thank you, Ben.